Hi, everyone. If you live to be 65, Medicare is going to be very important to you. And if you're already 65, you may have some questions. Gregg Kunemund is with UnitedHealthcare, and thank you so much for coming in to help enlighten us more about Medicare.
Great, thanks for having me.
Sure thing. Tell us out of the gate here, what is it and why should we care about Medicare?
Well, some interesting facts about Medicare. Number one, there's over 54 million people enrolled in it today. And in Tennessee alone, 1.2 million. So Medicare is a federal health insurance program, really for people over age 65 or due to disability.
So you could be under 65 if you have a certain disability?
Yeah, due to disability, yes, there's certain conditions and they could be eligible for Medicare.
Okay, so there is a pretty wide net then in terms of eligibility.
That's correct.
Okay.
About 85% are 65 plus.
Okay. Now for seniors and other people who are enrolled in Medicare, why is annual enrollment so important? So you have this time period every year to enroll. Why is that critical?
Yeah, for most seniors on Medicare or anyone on Medicare, they have one time per year to make changes. So it's really key during the open enrollment period, which begins on October 15th and runs through December 7th, and that would be for elections in 2019. So what happens if they don't make any changes, which they don't have to, it's really a checkup period. So even if you were working and you go through an open enrollment at work, the seniors and those on Medicare could just check their health plan that they're on today and ask them, just simple questions. Is it meeting their needs? Are their needs going to change? And what happens is if they don't make any changes, it could roll over into the next year. And that could be good, or maybe something that if there was some changes, it may not be so good. So really, it's just a time for them to do that checkup.
I saw on the graphic, it talked about the budget and different considerations. What might be some other things that would affect you making changes?
Well, first I would start, a lot of people think Medicare is confusing, and my mom and dad are part of that. And we found at UnitedHealthcare over 40% of people think Medicare is confusing. So we're going to walk through some simple steps to make sure that it isn't confusing. So I would first start with, from a health standpoint, is your health plan today that they're on in 2018, is it meeting their health care needs? And are those needs going to change in 2019? So that would be one. The second thing could be financial. And it's not just premiums that you're going to pay for Medicare, but it could be your co-payments, your deductibles, and your cost share. Are those things going to change? So for most people on Medicare, whether it's the drug plan or Medicare Part C plan or Medicare Advantage, they should have received an annual notice of change, and it will let them know the changes between 2018 and 2019. The other things I would start, so we did health, we did financial, and then look at your prescription drugs. There's things such as drug lists and formularies. Are the drugs you're taking on your plan today, are they changing, and are those costs changing?
Because obviously people, the status of your health can change dramatically in the course of 12 months.
Right, that's correct. So that's why you kind of look at all those. You want to make sure your doctor and your hospital's in the network. And there could be some other things that Medicare may not cover that for example, a Medicare Advantage plan would. So it could be a fitness benefit or dental. So I would just do those simple things. Make sure you understand that window, because it's really important, between October 15th and December 7th. And they don't have to make a change. You could stay on that plan if it's going to meet all those needs, or you may want to look at it, because Medicare isn't a one-size-fits-all. In fact, my mom and dad have different plans, based on their needs.
Okay. Now, we've all heard of Medicare Part A, Part B. Explain what all of that means, the difference between A and B.
Right. Well, we take our seniors and those on Medicare back to school. So Medicare basically has four parts, if you think of it. Medicare Part A is your hospital and your skilled nursing facilities. Medicare Part B are your physicians and your outpatient. And that part covers 80%, so you would have a cost share of, say, 20%. Medicare Part D, as in dog, is a prescription drugs, and that covers, obviously, your drugs. And the last one is a Medicare Part C. So there's actually four parts, which is Medicare Advantage or Medicare Part C plans. And most of those plans, they're a combination of your A, B, and D all into one. So you have basically Medicare A, B, D is your drugs, and C is a Medicare Advantage.
Okay, I see that. Good breakdown on the screen as well. The graphic helped break that down as well. Medicare Advantage also, it's one of the options people can consider. And I understand it's experienced rapid growth in the enrollment over the years. What is Medicare Advantage and what's driving all of that growth?
Yeah, so Medicare Advantage are also known as Medicare Part C plans, and they're run by private insurers like UnitedHealthcare. There's over 10,000 people today aging into Medicare, and the boomers have found Medicare Advantage very popular. In fact, out of those 54 million plus enrolled in Medicare, 1/3 are in Medicare Advantage plans. And some of the reasons they're so popular, one is just ease. You have one card and it covers your A, your B, and also your drugs in most cases. So it's convenience, there's fixed co-payments. And most seniors have found in those on Medicare that Medicare Advantage plans also cover things Medicare may not, traditional Medicare, which could be a dental. UnitedHealthcare has a house call program, fitness benefits, vision and glasses. So it covers additional services that you may not receive under a regular Medicare.
I see on the, can we go back to the graphic for just a second too? I see where it says maximum out-of-pocket limit. Let's
Correct.
talk about that a little bit.
Right, because when we talked about Medicare A and B, I talked about the 20% coinsurance. You could pay that, for the entire year. Medicare Advantage plans do have an out-of-pocket limit. It could be as high as $6,700, and if that's the case, if you meet that amount, which is quite high, but after you met that amount for your Medicare A and B services, your payments would be zero, and everything would be covered at 100%. So there is some fixed costs associated with it, so that you're not going to have a whole lot of dollars spent each year.
Okay, now people are facing obviously some pretty important decisions over these next few weeks, the enrollment period. So what are some resources that they should be aware of to help support them as they make these critical decisions? They really are critical decisions.
Yes, and there's a lot out there, community services. I love a website called Medicare Made Clear, and I do that for caregivers and boomers aging into Medicare. It's kind of a Medicare 101. It just walks you through some of the things we talked about.
Medicare for Dummies? Sorry, no,
Medicare 101.
Okay.
So that's Medicare Made Clear.
Okay.
UHC Medicare Health Plans is a good website during the open enrollment period where they could research our plans. There's also a phone number they can call, 1-800-UHC-6509. So there's a lot of community sources out there that they can use, those websites I listed.
Well, your folks are lucky to have you in the position you're in to walk them through this. And, what has their feedback been?
Yeah, my mom and dad, my neighbors, the people I go to church with. My brother's a boomer. He's aging in, so I was with him this past weekend. So I always tell them, take a deep breath. I'm going to help them. I've worked in Medicare for 30 years. It's changed. It's evolved over time. But just ask those basic questions. Is the plan they're on today meeting both their health and their financial needs? Are those needs changing? What's available out there? And do their research. So don't be afraid to use community resources. There's agents in the field, and there's local meetings that UnitedHealthcare has. They can go on our websites, and there'll be licensed agents that could go through that. And really, at the end of the day, they may be happy in the plan they're on today, and they don't need to make a change. But if they want to, use that time frame in order to do that for 2019.
All right, thank you so much for this tutorial. Very, very helpful. Thanks,
Oh, my
Gregg.
pleasure. Great to be here.
All right, and we'll be back with a lot more right after this.